the location?
Yes, I'm here.
Good. Make sure that you get the right video. Better watch it first. You only have 10 minutes to send it to my system. Do it quick and escape before the alarm.
Access granted.
Ah, here it is. The cardiac tamponade video file.
A medical emergency. What is cardiac tamponade? Cardiac, which means pertaining to the heart. Tamponade, directed from the French verb tamponner, means to plug up or to smash into. Putting these together, a smashing or squeezing of the heart happens in a cardiac tamponade. But why does this happen? A fibrous sac called the pericardium surrounds the heart. This sac is made up of two thin layers. Normally, a small amount of fluid is found between them. This fluid prevents friction between the layers when they move as the heart beats. However, in some cases, extra fluid can build up abnormally between these two layers. This is what we call pericardial effusion. If too much fluid builds up, the extra fluid can make it hard for the heart to expand normally. This creates extra pressure, which then smashes and squeezes the heart. With this, less blood enters the heart, reducing the oxygen-rich blood going to the body. Cardiac tamponade happens when someone experiences a trauma. May it be penetrating trauma such as stabbings or gunshot wounds, blunt force trauma like car accidents and falls, or traumas from heart attack and cardiac surgeries. A person with an infection or inflammation of the pericardial sac called pericarditis, cancer, autoimmune disease like lupus, reactions to certain medicines, radiation treatment to the chest area, or chronic kidney failure may also be at risk for cardiac tamponade. Now, how do we recognize someone experiencing cardiac tamponade? Remember these: low oxygen, pulsus paradoxus, and the Beck's triad. First, we all knew that because of the pressure that squeezes the heart, oxygen-rich blood going to the body lessens. Patients with low oxygen typically present restlessness and confusion, temporary loss of consciousness, anxiety, chest pain or discomfort, tachycardia or a fast heart rate of more than 100 beats per minute, and shortness of breath. Another, because of the blood coming out of the heart reduces, the stress put on the blood vessels also decreases, which causes a drop in systolic pressure or the top number in a BP measurement. In result, the patient will be having a narrowed pulse pressure, meaning the top and bottom numbers are getting closer to each other. For example, in the normal blood pressure of 120/80 mm mercury, we have a pulse pressure of 40. Compared to a blood pressure of 80/70 mm mercury, we have 10, a narrowed pulse pressure. Lastly, described in 1935 by cardiothoracic surgeon Dr. Claude Beck, a triad of clinical signs of cardiac tamponade. This consists of a jugular vein distension. Because of the increased pressure, the jugular vein bulge, making it most visible on the right side of the patient's neck. Muffled heart sounds. Upon auscultation or putting a stethoscope directly on the patient's chest, heart sounds may be decreased because of the fluid accumulation in the pericardial space, and hypotension or low blood pressure because of the decreased work and output of the heart. To further diagnose a cardiac tamponade, the physician may order some tests. To see the heart anatomy or structure, a chest X-ray will be ordered. Results will show a slight widening and largening of the heart, more of a water balloon shape. And to look at the fluid surrounding and the motion of the heart, an echocardiogram or echo will be performed. Results will display that there is indeed an accumulation of fluid around and a swinging motion of the heart may be evident. And lastly, To check the heart's electrical rhythm, an electrocardiogram or ECG will be done. Results will present uneven low voltage waves in the QRS complex, with short and uneven heights. This is because the ventricles try to compensate for being squeezed, so they try harder to pump back under pressure. Having positive for all the signs, symptoms, and diagnostic tests, cardiac tamponade shall be acted on immediately. A quick removal of the pericardial fluid is needed. The most common procedure to do so is a pericardiocentesis. The physician inserts a needle through the chest wall and into the tissue around the heart. Once the needle is inside the pericardium, a long, thin tube called a catheter is inserted. This catheter shall be used to remove the fluid. In certain cases, cardiac tamponade may be treated with a surgical option. The surgeon makes an incision over the breastbone to access the heart, then removes either a small part, a procedure called making a pericardial window, or the entire pericardium, or what we call a pericardiectomy. With these procedures, nursing management are as follows. As ordered by the physician, provide oxygen and medications as well as start 2 large-bore IVs and have fluids available for resuscitation. Ensure that the patient is in bed rest with the legs elevated. Confirm that a chest X-ray and echo are done prior to the procedure. Perform necessary steps and considerations on ECG placement. And have the pericardiocentesis or pericardiectomy trays ready. Postoperatively, monitoring the patient is vital. Therefore, the nurse shall regularly assess the surgical site, vital signs, oxygenation, urine output, ECG results, heart and lung sounds, and the patient's risk for anxiety. Usually, after pericardiocentesis, patients will be discharged after a day, however may take a couple for those who underwent surgery. Before discharge, the nurse shall educate the patient on signs to look out for in cardiac tamponade, for in some cases, fluid buildup may happen again. Lastly, instructions regarding the patient's follow-up checkups and diagnostic tests like chest X-ray and echo shall also be explained. 60 seconds till alarm. To put it briefly, cardiac tamponade is a life-threatening situation in which there is such a large amount of fluid that builds up in the space around the heart. This fluid puts pressure on the heart, causing it to interfere with its performance. This may be caused by trauma or other complications that cause effusion. A prompt removal of the fluid shall be done to help relieve this pressure. A continuous monitoring of the patient's vital signs and follow-up tests are necessary after the procedure. A note to keep in mind is cardiac tamponade may recur. Hence, looking out for signs and symptoms is very important. The file has been sent.